Welcome, and thank you for choosing the University of Washington Medical Center for your potential surgical care. I'm Brand Oschlager, and I represent the Center for Esophageal and Gastric Surgery, and we'll be talking today about your upcoming surgery, specifically about your surgery for esophageal cancer. Let's talk about your preparation for esophagectomy. Your participation before surgery is critical to the success and decreasing complications after surgery. One of the best things you can do leading up to surgery is get enough exercise. I tell people that a rule of thumb is you should be walking at least a mile a day if you're going to clearly be strong enough to get through a surgery safely. If you can do more than that, great. Please keep exercising. It's only going to help you. If you don't feel like you can walk a mile a day, then get at it. Start working up to that. And if you have to divide that mile up into 3 or 5 small walks a day, do so. Whatever you can do to make your body stronger is going to help you. Nutrition. Please pay a lot of attention to good nutrition. Most patients with esophageal cancer are not eating normally. And then they're going through chemotherapy and radiation and things that are going to decrease their appetite and willingness to eat. We really want to do everything we can to prevent you from losing weight during this critical time before surgery. If you are having trouble, please let your oncologist know immediately if you start to lose weight. And if they aren't getting aggressive and your weight is not stabilizing, please let our staff know as well. There are things that we can do, and the last thing we want is to find that you've lost so much weight that it's not safe for surgery when you come back in for your preoperative appointment. You really should not be smoking. Smoking is a difficult habit to break. We appreciate that. But this operation, more than any, is very risky for a smoker. Not only does it affect your lungs and make lung complications more frequent, it also really decreases wound healing. And it is critical for this operation that you have all the facilities possible for you to heal your incisions and the reconnections in the plumbing. Please make preparations to have friends and family around after surgery. It is our hope that you'll walk out of the hospital under your own power and that you will be able to do a fair number of things for yourself at home. However, this is a big operation, and having people around to shop for you, help you prepare meals, keep an eye on you for some of your activities of daily living is really helpful and will be beneficial to you. We know that you don't want to inconvenience your family and friends, but we are also confident that there are people out there that want you to do well and are willing to help you in this difficult time. Reach out to them. They're there to help you. If you do have special needs that you think your family and friends cannot provide, please reach out to our team early on. There may be things that we can do and help you prepare for surgery. Finally, our staff will talk to you about some special dietary things before surgery. Specifically, you'll be asked to take apple juice the morning before your operation. A lot of people ask why this is the case, and it is because we've learned very recently that if we starve patients for too long, it changes some of the hormones and metabolism in their body negatively around surgery. So we try to keep a little bit of sugar and other nutritional things going into your system prior to surgery. So what are things going to look like when you wake up from surgery? Well, it's a big surgery and we have a lot of tubes and things coming out of you. What you'll notice is that in the operating room, we'll have had a breathing tube in. That will come out almost always before you wake up in the operating room. but you might have a sore, scratchy throat for a few days afterwards. You'll wake up with an oxygen mask that will stay until you're breathing normally. You'll have an IV. These are some of the basic things. Before surgery, you'll have an epidural catheter placed in your back. The reason for this catheter is that it is meant to numb the upper abdomen and chest area to decrease the pain from your incisions after surgery. It's a very safe procedure and really creates a lot of benefit to decrease the overall narcotic use through your veins that will tend to make you sleepy and groggy so that you can have good pain control and be more awake to participate in your recovery. We place a tube in your nose called a nasogastric tube. That is there to drain your stomach so that it doesn't get too distended and put stress and tension on the connection that we just made. Usually that tube's in about 2 to 3 days. We leave it in there until it's putting a low enough amount out that we think that your body can easily take care of those secretions. We put a feeding tube directly into the abdomen, and that will be used to supplement your nutrition in the first few weeks after surgery. Now, you will start to eat approximately 3 or 4 days after surgery, at least drink. And so this is just a supplement, but there's not a single person who is able in the first week to take in 100% of their calorie and nutritional needs. And this is a big operation that you're healing from. So a feeding tube allows us to give you all the nutrition you need to make a maximum recovery. There'll usually be a surgical drain. Depending on the procedure, it will be in your neck or in your chest. That stays in for most of your hospital stay, and you will usually be removed before you leave. And that's just there in case there's a problem from any of your connections and there's a leakage, that hopefully that will contain the leak and not require more surgery. You usually wake up with a catheter in your bladder. We'll keep that for a day or two and then remove it. And that is there to monitor your urine output. And also in the first day with the epidural catheter, you're probably not feeling like getting up every 2 hours to go to the bathroom, and it allows a little bit more convenience to you and your mobilization. And finally, you'll have some leg devices. They're called sequential compression devices, or SCDs. They're there to push on your calves and help your blood circulate to prevent blood clots in your legs. Those are the main things that you'll wake up with and find. And what will happen is over the 6 or 7 days that you're here, every day or every other day, we'll be taking one of these tubes out so that by the end, you'll go home with the feeding tube, but hopefully no other tubes left attached. So what else is going to happen in the hospital? First of all, a family member can visit. You may spend a night in the ICU. If so, we usually ask that the families stay in the waiting room or take that night off. But on the floor, a family member is allowed to stay if they choose on a small cot that can be brought in. We will crush your medications or give them to you in liquid form, and we're going to get you active as soon as possible. We want you to be out of bed and starting to walk the day after surgery. Sure, it's a big operation and you will probably be in some pain, but that really is critical to get you going, get your lungs expanded, get the blood moving to prevent blood clots, and is one of the most important things you can do to decrease complications within and after the hospital. We'll be monitoring your nutrition. We'll tell you when you can start eating and drinking and starting the tube feeds. Don't worry about that, but we will ask you to be a participant in learning what you need to know upon discharge for that. And you'll be given a breathing exercise machine called an incentive spirometer. It's a blue plastic device that you blow into to try to help re-expand the lungs. Next to walking, this is the most important thing that you can do to speed your recovery and decrease the risk of complications. Within 6 to 7 days, we hope to have you out of the hospital. If you live more than 2 hours away, we will probably ask you to stay in the Seattle area for up to another week. This is mainly so that if there are any complications or problems, we can address them immediately and safely. And if you live quite far away, that will be difficult, and we worry that we won't be able to get to those problems in a timely manner. We hope that if you're staying in Seattle, you're doing all the things you would normally do at home, getting up, getting about, and being active in pushing your recovery forward. You obviously should have someone to drive you home. You should come prepared with loose, comfortable clothing. You may want to bring a pillow for comfort and support. Probably not going to want to drive for at least 2 weeks after surgery, especially while you're taking prescription pain medication. You're not going to swallow whole pills for about 4 to 6 weeks. All your medications will be crushed or in liquid form. Our team and our pharmacists will go through all your medications and make sure they're in a safe form for you to go home and explain those to you. Controlling your pain is very important to us. There are a lot of things we recommend around this. I've already mentioned the epidural catheter, but there are many things besides narcotic pain medications that you can use to reduce your pain. And we encourage you to use these things. Having music around, both in and outside the hospital, we found often helps soothe people and decreases their pain. Ice to incisions or swollen areas is another adjunct that people find effective. You want to make liberal use of Tylenol and non-steroidal anti-inflammatory medications like ibuprofen, and use those when you have mild to moderate pain rather than going straight to narcotics. Remember, there are many adverse effects of prescription pain medications like dizziness, nausea, constipation, and drowsiness, all of which you will want to avoid if possible. That being said, if you have severe pain or have difficulty sleeping because of pain, we do want this to be controlled, and we will send you home with pain medication to help you. Diet and nutrition are one of the big things that we have to adjust to after esophageal removal. You'll be getting tube feeds, as we've mentioned. You'll be on a progressive soft diet on the way home. What you really want to do is be very careful to eat slowly and drink slowly very frequently through the day. You want to think 5, 6 or more meals a day, maybe sipping and drinking fluid almost constantly through the day, and not trying to compress your food and liquid intake into the 2 or 3 meals a day that you might have normally been used to. You will be able to compress some of that with time, but in the early stages, we encourage you to spread them out so that you don't fill your stomach up too much at any one time. And if you feel full, please stop. Your stomach needs more time to digest what you have, and slow down and space things out. Fortunately, again, you have the feeding tube to help supplement things, and so you can let it do its job if you're not able to eat. Other aspects of activity. We want you to be active. We want you to walk as much as possible without getting to the point of severe fatigue. We want you to be active, but it's going to be progressive. We want you to avoid heavy lifting. 15 pounds is a good guide. Some bigger, stronger people might be able to do a little more, some people a little less, but really just don't use your abdominal muscles for lifting objects in the first 6 weeks. You're probably going to want to avoid most strenuous activities like running or going to the gym for about 6 weeks. But we do want you walking frequently, at least 3 times a day, and trying to get back to that mile a day you were doing before surgery as much as or as quickly as possible. We'll ask you to take the breathing tube, the incentive spirometer, home with you and continue to do those breathing exercises to regain all of your lung capacity that you might have lost or was decreased with surgery. And you can resume most of your other activities. People often ask about, when is it safe for me to resume sexual activity? Usually somewhere in the 2 to 4 week time period is a good rule of thumb. But for all this, let pain be your guide. You need to push through a little bit of pain to get out of bed, get off the sofa, and go walk. But otherwise, before going to the gym or engaging in sexual activity, things like this, if you're having pain and you're not able to do these things because of pain, that's probably where your limit is for now. And you'll get back to those things quite soon. We're very confident of that. It's important to take good care of your wounds. Your wounds will probably have little butterfly bandages that we call steri-strips on them. Please don't remove those in the first week after surgery. Most of that time you'll be in the hospital. They'll fall off in about a week or two in most cases. In some cases, they'll stay on, and if you want to, after a week or two, start to remove them, that's totally fine. People often find that they're easiest to get off in the shower after you get them a little bit wet. In the first couple weeks, it's good to not get your incisions too wet. Don't soak in a tub or a pool. Showering is fine. Getting it a little wet is okay, especially to clean the area. But dry them off and keep your skin in and around the incision as dry as possible. Keep an eye on it. If you notice any increased pain, redness, swelling, or foul-smelling discharge or increased discharge from your wounds, please let us know. Don't apply anything to your incisions. There's a lot of over-the-counter salves or ointments people will recommend. Generally, soap water and keeping it dry is the best medicine for surgical incisions, and not over-the-counter antibiotic creams or otherwise. When you leave, you should have a follow-up appointment to meet with our surgical team and dietitian. It'll usually be in the first 2 to 3 weeks unless specified by us otherwise. And then we will see you every few weeks until you're back to eating enough that you can have the feeding tube removed, and we'll take that tube out in clinic. It's really not much of a procedure. We just cut the little stitches that are keeping it affixed to the skin, and we just pull it out. It's not very painful at all. And then we'll follow you until we are all comfortable that you're okay to be seen and followed by your primary care doctor and probably oncologist, who will be the main person to do your long-term cancer screening, surveillance, and follow-up. If you have any questions, please call us. We have a team at all times waiting to take care of you and answer your questions. But let me give you a sense of some things that you may want to call about, or we want you to call about. If you're unable to take in food or liquids, especially if you were able to do so in the preceding days and now you're not able to, call us. If you can't keep fluid down, call us. If you start vomiting despite taking the anti-nausea medication that we send you home with, give us a call. If you have symptoms of chest pain or shortness of breath without exerting yourself, give us a call. You should not have severe increasing pain that is not controlled by the pain medication we sent you home with. If you are experiencing significant pain, give us a call. If you're having any trouble feeling distended, having a lot of trouble moving your bowels, and feeling really backed up, let us know. It is common to feel a little constipated and not get back to a regular bowel movement cycle. That will come as your bowels wake up and you get rehydrated. But if it's taken a significant turn backwards, please let us know. We may be able and probably can help. If you have dizziness, fainting, any signs of dehydration, let us know about that as well. If you have weakness, numbness, tingling of your extremities, if one of your legs or arms feels warm, painful, swollen, let us know. They could be signs of a blood clot. If you notice any bleeding from your incisions, let us know. And certainly any signs of infections like a high fever, shaking or chills, increased drainage from your wounds, redness more than a half an inch around the incision. Those are signs and symptoms that you could have an infection and that we may need to take a look at you. And here are the numbers to call both during the day and outside the day. As I said, there's always a member of our team standing by to take care of you. We want this to be the safest experience possible and give you the information you need to make a rapid and complete recovery from esophageal surgery. Thank you for taking the time to watch this video. We really look forward to taking care of you here at the University of Washington in the Center for Esophageal and Gastric Surgery. We have developed a tremendous amount of experience in treating esophageal cancer, and we look forward to taking care of you over the next few weeks. Thank you.